The way they approach the patient, the way they just, put the questions will itself cure the patient.
I didn't have any iota of hope that I will be able to walk now, but I am now walking.
அவங்க சர்வீஸ் சின்சியராகவும் பேஷண்ட்டாகவும் டெடிக்கேட்டடாகவும் இருக்கு, அன்பாகவும் இருக்காங்க.
In the time I have been here and I've been spending a lot of time here with my mother, is that they treat people with a lot of dignity.
No hesitation whatsoever in recommending the services of this hospital to all my friends and relatives. With warmth, they provide excellent service.
எனக்கு ஒரே பையன் அமெரிக்காவில் இருக்கிறதுனால இங்கே கொண்டு வந்து சேர்த்துருக்கிறதுல எனக்கு ரொம்ப மகிழ்ச்சி.
So that's why I say Geri Care, I find it the best.
The journey of Geri Care is one of an inspiration. We started off as a small organization comprising of 2 geriatricians and 4 qualified nurses, specially trained geriatric physiotherapists. In a short span of 4 years, due to our ethical practices and dedication, and also demand from the patient side, we have evolved from a small organization to true 360-degree care to any elderly person in the city, which includes 2 super-speciality hospitals, one in T Nagar and the other in Adampakkam, which are exclusively dedicated to senior citizens. Additionally, we have 3 assisted living centers located in Thoraipakkam, Mogappar and Arepuram. Moreover, we run 4 outpatient clinics across the city and offer full-fledged home care services from all these facilities in the city.
What we mean by 360-degree care, it starts from consultation at home, if required hospitalization, and post-hospitalization care. It could be either care in the assisted living or a post-hospitalization follow-up.
Geri Care Hospital is India's first private hospital exclusively for senior citizens. The infrastructure and the facilities are all designed to keep the well-being of elderly a priority. Our hospital has a team of intensivists and emergency care physicians trained in geriatric to handle the acute problem of elderly. This hospital is run by a team of geriatricians with decades of experience in their respective field. We have around 12 geriatricians who are supported by super specialists. We have geriatric cardiology and nephrology and neurology and geriatric oncology and orthogeriatrics who can provide in-depth care for senior citizens.
To manage these kind of complex patients with lot of comorbidities, it is always better to have this kind of a comprehensive geriatric setup where we have multiple geriatricians to give us round-the-clock support in case these patients run into problem after any kind of procedures.
We have gained experience and we are trained in treating this group of patients. So we understand what problems they can have, how they can manifest. Elderly people are not always able to communicate what is going wrong with them. So we need a group of people who are very in tune with the problems that they face.
நல்ல சர்ஜிக்கல் ரிசல்ட் நம்மளால் இப்போ ஒரு மினிமலி இன்வேசிவ் ப்ரொசீஜர்ஸில் ஒரு குட் ரிசல்ட்ஸ் கொடுக்கக்கூடிய ஒரு காலகட்டத்தில் நம்ம இருக்கோம். அது மாதிரியான ஸ்பெஷலிஸ்ட் நம்மளை சுற்றி இருக்காங்கங்கிறத ஜென்ரல் பப்ளிக் புரிஞ்சுக்கிட்டோம் அப்படின்னா, வயசாயிடுச்சு பண்ணணுமா, ஃபிட்டாக இருப்பாரா வேண்டாமா, ஒரு டயலமாவில் ட்ரீட்மெண்ட் கொடுக்காம ஒரு பேஷண்ட் அவரோட குவாலிட்டி ஆஃப் லைஃபை இழந்துடக்கூடாதுங்கிறதுக்காக இதை டீட்டெயிலாக நாங்கள் சொல்கிறோம்.
Most important in ICU in geriatric is transparency. We doesn't mind that to keep the explaining everything and keep very transparent. And that's make us stand alone from the other institution.
Recently we did a patient with breast cancer. She is a thin, frail lady who was also more than 80 years of age. Many of us would have thought that she will not withstand a big surgery like a mastectomy for her age and for her condition. But here at Geri Care, we were able to do that surgery successfully and now she is disease free.
And that's where the importance of the geriatric oncology program comes in, where it is a multidisciplinary department where that the geriatric physicians, who are the primary care physicians of patients at Geri Care, interact closely with the medical, surgical and radiation oncology team.
Nurses at Geri Care are well qualified and trained by geriatric nurses and soft skill trainers. We verify that the nurses have completed their 2 years nursing assistance course before joining us. The nurses are provided with a good and hygienic hostel services and transport services to reach the patient's premises safely.
By the term assisted living, what do you mean is that senior citizen at some point of time might require assistance in his daily activities. They may require help in their bathing, their toileting needs, their feeding needs, even for changing their clothes. So that we are able to provide through our skilled nursing facility run by exclusive geriatric nurses. They have a team of nurses, physiotherapists, speech therapists, dietitian, and it is managed by a team of doctors comprising of geriatricians and general physicians.
Morning when I come to the hospital, along with nursing in charge and the nurses, I go for the daily rounds. As I move to the patient, I ask them whatever is their symptoms, then we focus on that, and once I find anything that has to be done actively, then we do that during the regular rounds. Supposing if there's a need to address it still further, then we speak to the family.
24/7 வந்து எப்போவுமே நர்சஸ் வந்து டோட்டியில் இருப்பாங்க. எவ்ரி ½ an hour ஒன்ஸ் வந்து பேஷண்ட் ரூமில் போய் விசிட் பண்ணுவாங்க. இந்த பிட்வீன் டைமிங்கில் பேஷண்ட்டுக்கு ஏதாவது நீட்ஸ்னால் அவங்க வந்து கால் பெல் ப்ரெஸ் பண்ணுவாங்க. உடனே வந்து சிஸ்டர்ஸ் போய் அதை ரெக்டிஃபை பண்ணி கொடுத்துருவாங்க.
ஃபிசிக்கல் ஹெல்த்துக்கு நிறைய இம்பார்ட்டன்ஸ் கொடுப்போம். அவங்களுக்கு டே டு டே ஆக்டிவிட்டீஸில் எக்ஸசைஸ் ப்ரோக்ராம்ஸ் இன்க்ளூட் பண்ணுறதுனால அவங்களோட ஜாயிண்ட் ரேஞ்ச் ஆஃப் மோஷன், மசில் மொபிலிட்டி, மசில் ஸ்ட்ரென்த், balance and gain, that is walking pattern improve ஆகும், which will help them to reduce risk of fall in long run.
வாக்கிங் பார்த்தோன்னா இப்போது இருக்க லைஃப் ஸ்டைலில் மஸ்ட். நம்ம வாக்கிங் விட்டுட்டோம்னா நம்ம மசில்ஸ் எல்லாமே வேஸ்டிங் ஆக சான்சஸ் இருக்குது.
We have a weekly based diet plan as we restrict with a low salt, low fat, and meanwhile it is not a boring or a bland diet.
இன்டோர் கேம்ஸ்னு பார்த்தீங்கன்னா கேரம் போர்ட், செஸ் விளையாடுறது, டிராயிங் பண்ணுறது, ஒரு ஃப்ளோர்லேருந்து இன்னொரு ஃப்ளோருக்கு போய் விளையாடுறதுனால அவங்களுக்கு ஃப்ரெண்ட்ஷிப்ஸ் வந்து ஃபுல்லாக நீங்கள் யாரை வேணால் கேளுங்க, எல்லாரும் சொல்லுவாங்க எனக்கு 30 ஃப்ரெண்டு இருக்குது, 25 ஃப்ரெண்டு இருக்குது.
சண்டே ஈவினிங் கிளாஸ் இருக்க வரேன், யோகா மாஸ்டராக இருக்கேன், நான் யோகா டீச்சர். அவங்க இந்த ஆசனாஸ்லாம் சிம்பிளாக சிட்டிங் பேஸ்லேயே ஆசனாஸ் பண்ணுறோம், சேர் சிட்டிங்லேயே பண்ணுறோம். நிறைய அவங்களுக்கு ஜாயிண்ட் பெயின், நெக் பெயின், ஷோல்டர் பெயின், ஃப்ளெக்சிபிலிட்டி எல்லாம் நிறைய இருக்குது, நல்ல இம்ப்ரூவ்மெண்ட்ஸ் தெரியுது. ப்ளஸ் மெடிடேஷன்ஸ் பண்ணும்போது அவங்களுடைய ஆன்சைட்டி, ஸ்ட்ரெஸ்ஸு இதெல்லாம் நிறையவே குறையுது.
For senior citizens, a long waiting period, area with a poor car parking, it makes them difficult to access to a clinic. So we in Geri Care Clinic are very mindful of that. We wanted that elderly should have a less minimal waiting time. They should have a longer consultation with their geriatricians, and as well as they get all the allied services like a physiotherapy or a lab requirements or their ECG or echo or ultrasound, and it should be located near their homes. Geriatric patients sometimes need dental requirements, their eyes needs to be checked, and those are the problems which can be addressed at the clinic level itself. So with regard to home care services, we provide geriatric doctor visits at home, skilled nursing visits at home, and caretaker services for home, as well as the physiotherapy, lab and pharmacy services at their doorstep.
When I go for rounds in the morning, before I would ask them how are you, they would ask me how I am, and they would ask me if I had my food. So that positivity is very contagious. And I would say that is what keeps us going every day.